A new report tonight shows the Cuyahoga Metropolitan Housing Authority is failing to report elevated blood lead levels in children. The agency blames it on a clerical error. Our team is covering all angles. 3 News investigates. Peter Fleischer tells the story of a father who lost his son to lead, but with what's in the report, which some city leaders are calling a dire situation. Bryant, good evening.
They are 10 kids all testing positive for elevated blood lead levels. All of those kids living inside the Cuyahoga Metropolitan Housing Authority. And according to this new report, CMHA not only failed to report to the issue, but also failed to comply with federal regulations.
It's children, and children, someone got to look out for children. And you guys did not look out for those children. That's burning it in my soul and in my heart.
A passionate city councilman expressing his frustration about the latest report by the United States Department of Housing and Urban Development. The report shows between 2020 and 2022, CMHA did not comply with HUD's reporting and verification requirements for cases of children with EBLL. The report goes on to say CMHA did not visit 59 units within the required time frame. 9 of those units had a child under the age of 6.
1 occurrence is too many. So 10 occurrences is not something in any respect to minimize.
Jeffrey Wade with CMHA could not explain the reporting issue, but says the matter has been fixed.
Full stop, point blank. Was there an issue for reporting the elevated blood levels in kids?
To the Department of Housing and Urban Development, from CMHA to HUD, there was during the period of the audit, yes.
Why is that not?
There's no good explanation for that.
Now, the Inspector General report is calling for CMHA to modify and address reporting concerns.
It's our job as parents, it's our jobs as adults to look out for children. Children gotta know that they can count on you. And you guys did not look out for those children.
In Cleveland, Bryant McCrae, 3 News.
Also, 3 News investigates discovered families living in CMHA units have been battling the risk of lead exposure for decades. Investigative reporter Peter Fleischer is live in the newsroom now. And Peter, I understand you spoke with a father whose son died after being exposed to lead as an infant.
Yeah, Russ, that's right. And you can hear the emotion in family and city council voices. In that meeting, CMHA confirming at least 11 instances of elevated blood lead levels were found in children in their units from 2020 to 2022. And for one Cleveland family, that brings up their worst nightmare. They had urgent advice for every parent involved in this situation. I met Derek Wade at his son Demetrius's gravesite this week. It's been almost 17 years since his son's passing, but Demetrius's autopsy shows issues with his kidney, liver, and heart. Issues his father says are related to lead exposure. Derek raised his family in that building, in CMHA housing, and after his son dealt with health and behavioral issues at a young age, he got him tested, discovering dangerously high levels of lead. Derek says once lead sets into a child's body, the results can be tragic. He had a strong message for any parent who was worried about potential lead exposure.
Cognitively, lead affects the neurological system as well as the physical organs in the body. So I would say to the parents to get their children tested as soon as you find out their elevated lead levels. You must fix that problem.
Now tonight at 11 on What's Next, I'll explain how to know if your child might have elevated blood lead levels, and I'll tell you whether or not CMHA's answers from today match the findings of that Inspector General's audit. Back to you.
All right, Peter Fleischer in the newsroom. We'll see you at 11.